most of all, what's going to hurt is the mothers. It's the mothers who are fighting for their children, are fighting for the system, are fighting for just their child to be taken care of the right way. And now we have to fight for this bill. That's sad. Our queen, before she died, her thing was to take care of children because she couldn't have no children. And this is what she has to see, what Hawaii is going through. That's not aloha to Hawaii. That's sad.
Presently, the bill excludes 264,000 of Hawaii's people from having an external review of health plan denials because it excludes Medicaid members. 40,000 of those Medicaid members are aged, blind, and disabled.
We're afraid that if that does get passed, that chemo's his rights, for his medical needs might not be made. We might not get what he needs, his care. That's the main thing that we're afraid of, because you hear enough stories of people dying, and I heard a story of the little boy that just passed away because he was denied medication. So things like that. That's our main concern, is just afraid of what's to come and what's going to happen to him.
Over the past 10 years, I've been involved with 30 cases. I'm presently involved with another 15 cases, but prior to 2011, I was involved in 30 cases, and those 30 cases all concerned life-threatening situations, all concerned medical care that people needed to avoid very serious injury or the loss of their life.
My genuine feeling that it's the measure of a government, how it cares for its weakest members is the moral standard of what we all should stand by. And the fact that this bill is going to effectively take away any rights that these kids have doesn't make any sense to me whatsoever. These kids are already struggling. I mean, their daily hardships are more than any of us ever face. And now we're just going to take the rug right from under them. And I just morally can't live with that.
So we've got to make sure that the legislature understands excluding Medicaid members from our external review, treating them differently from everybody else, is not acceptable. We got to have a level playing field, and we've got to make it fair for everyone.
I have a 4-year-old daughter with severe disabilities. When she was born at about 3 weeks of age, we noticed that she started having seizures. And before a week or two after she was born, she was having over 1,000 seizures per day. And so it was definitely severe and complex. We had no help. We had no nursing for the first couple of years. It was touch and go with Hannah's life. I spent a lot of time on the mainland in hospitals. Then we met Raphael, and we exercised Hannah's rights to go through the external review. And so far she's had the care that 2 of her physicians say that she needs, which is 24/7 care, nursing care, skilled nursing care. And she does have that care because we were able to get that through going through this process. And one of our fears is that if this is Senate Bill 1274 passes, is that she'll lose her nursing that she needs for her medical health and safety.
This law is sicko coming to Hawaii. The stories that you've heard across the nation about folks being ruined by expensive medical care their health plan decided to deny even though they had paid their premiums, those kinds of cases are the kinds of cases we're talking about. In those other states, those folks had access to the process that the health plans are attempting to substitute for our existing law. And that is why they're lobbying so hard for this substitution, because their risk is substantially diminished.
Well, my ability of being a caregiver and what this bill would be doing for Hannah, they want to offer her 4.6 hours. Hannah needs 24/7. She needs a lot of physical therapy, occupational therapy, education, movement, love, and feeding, and all of that. And if this bill passes, how is she going to get that? Who is going to give it to her? You know, families, they can do at a perspective, but 24/7, we have other children to take care of. We have our husbands to take care of, other people in our families to take care of. Hannah takes a lot of work, especially if they don't walk, they don't talk, they can't feed themselves. And you want the mainland people to be the ones to tell you that, oh, we're going to take this all away. That's not right. And especially for some of us locals who can't afford to go, outer islands, you're going to take that away from us too? That's terrible. If this bill passes, it's terrible.
I'm very concerned about the fact that health plans are lobbying to repeal our rights, because what they are doing is using your money and mine as taxpayers and as payers of premiums for health insurance to lobby to repeal our rights. What right do they have to have a say in it at all? These are consumer rights that our legislature passed and made sure that we would have a dozen years ago. This legislature has got to be stopped from taking them away.
I'm fighting for the rights of every Hawaiian citizen, because at any time they could be surfing and become injured and become paraplegic and be in the same position that these people are. I'm fighting for everyone, and it should be and I shouldn't be the only voice. I hope when you hear my voice, it's the voice of aloha and compassion that you hear, because it's for all Hawaiians. And right now they're trying to push the federal regulations and recommendations on all the states. If it takes away the rights of the people, it's not right.
Everyone, including the poor, the aged, the blind, and the disabled, must have an equal right to the external review that the people in the highest cost plans have, because we've got to have a fair society. Everyone needs to have the kind of representation that the people in the most expensive health plans have to make sure that their right to health care is protected.
I don't know how they came up with 96 hours. I mean, just looking at my daughter, she definitely needs 24/7 nursing care. She's really, disabled. She can't walk. She has a trach. She has a G-tube. Like I said earlier, that her room is equipped like an intensive care unit room.
In addition to cutting the hours, they were also cutting the skill level. So patients who need the skills of a registered nurse, their skill level is being cut back to either practical nurses or home health aides. And again, that has impact on the patient. I mean, patients are in the hospitals being cared by licensed professional nurses for a reason, and the same thing when they're at home, particularly if they're severely ill and very medical fragile, they need the skilled care. So that makes all the difference in the world to the health of the patient. And as you said, the result is often that they become sicker and do have to go for costly hospitalization and start from zero again to bring them back up to baseline where they were when they were under the care of a registered nurse.
I can tell you that your efforts have had a tremendous effect, because as the bill has worked its way through the Senate over to the House and now is going to conference committee, you've done a terrific job of persuading legislators that they needed to take a second and a third look. And you've also persuaded our Hawaii Insurance Commissioner that he needed to change his position, because it was the Insurance Division that introduced this legislation.
Well, it makes me feel sad, because it seems like a trend that's been going on, sort of boiling the frogs slowly, or I forget the expressions that they use, but it's a trend to, little by little cutting care to disenfranchise people, or, people that can't really defend themselves.
I'm sorry, but if this bill passes, you're not taking only our land away. You're taking what the Queen wanted, is to take care of her children. That's not taking care of her children. That's just hurting. That's not even what she asked for.